they've created a really pro-agency system, and it has to do with budget neutrality, where the expenditures from one year to the next can't increase by more than $20 million. That's the cap, which for a system that's paying $1 trillion a year, that's it's a drop in the bucket. So a small little variance in that causes a reshuffling of RVUs and a reshuffling of payments for all the codes to offset that, and thus we're the losers this year, where we're facing significant cuts. And so without lifting or changing budget neutrality or putting more money into the system, we're constantly in this mode of having to fight other people to avert our specific work from taking significant cuts. And beyond that, the system that's been created, the RVUs, most hospitals use those to base physician payments off of. So, going back to is the hospital, at least is our hospital partner doing better? Well, sure, the hospital partner may be doing better, but if you're an employed physician in a hospital, I'll bet one of your metrics is RVU productivity. So if we have the budget neutrality with the fee schedule, and we get hit with losing money from the codes we're producing to offset and pay for increases in other areas, well, that translates to a reduction in your RVUs. So if you do the same amount of work this year as next year, your RVUs will look 10% less because of the cuts that affect the revaluing of those codes. And so your hospital that's employing you is going to look at you and say, oh, well, you did 10% less work this year. You didn't meet your metric. We're not going to pay you your full salary, or we're going to renegotiate with you. And it's the same for people that are taking private insurers. A lot of the private insurers, they don't want to reinvent the wheel. They're going to set up their payment rates as a percentage of Medicare. And so they're going to just tie theirs to what the Medicare payments are. And if budget neutrality keeps driving payments down, well, I mean, that's easy for the private insurers. Hey, they get to pay less for what they're doing. And hey, it's not our fault. We're just paying you a percentage of Medicare. It's Medicare that's driving it down.